If you suffered an injury, but you're not actually having that many symptoms, do you really need to have surgery? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now, it's not a really common injury, but there is a condition, and you see it sometimes in baseball pitchers, but you can see it in people that are active that aren't necessarily throwers. But you can have an injury where the nerve inside your elbow, your ulnar nerve, actually snaps back and forth along that bony process, what we call the funny bone, and it can be a real challenge. But do you actually need surgery to fix that? In this Ask Dr. Geier video, I discuss that very question for somebody that's actually not having that much trouble with that problem. Rigers asked, I have a subluxing ulnar nerve. I think it happened probably due to weightlifting. I don't have any tingling, numbness, or weakness in my hand, just sometimes I can feel the snapping and occasional discomfort in my elbow. As I don't have any symptoms of nerve damage, in your opinion, should I consider surgery or not? Well, I guess let's first talk about the problem. So after some sort of trauma usually, but I guess in some people it can happen anyway, basically the nerve right back here, when you hit it and you get a shock-like sensation in your elbow and your fingers, that's not hitting the bone so much, that's hitting your ulnar nerve. And after trauma, the sheath that holds that nerve behind that bony prominence there can tear, and then that nerve can slide back and forth. People that have that, it's really aggravating. You know, somebody that does a lot of tennis serves, a baseball pitcher, if that nerve is snapping back and forth, it can be really, really aggravating. Early on, it's just the snapping and the discomfort with the snapping. As it goes further on, you can actually start to get changes related to essentially early nerve damage. You can get numbness and tingling in your fourth and fifth fingers. You can actually get weak with the grip and various use of some of the smaller muscles in your hand. So generally, we think when people start to develop some of the neurologic issues, the numbness, the tingling and weakness, we get nerve conduction tests to see the status of the nerve, but very often we'll do a surgery to basically stabilize the nerve, in a certain position so that it doesn't snap anymore. You could make a case if it's just a snapping and it doesn't really bother you and you're not having nerve symptoms. In theory, you could watch it, try to avoid surgery, go back to lifting weights and throwing, whatever it is, and see how it goes. Now, the concern and what I would watch for is if you start to develop numbness and tingling and those things. We think that repeated trauma by that nerve going back and forth could create some long-term changes. So if you start to develop any of those symptoms, you might consider doing it. I will tell you that most people, that snapping sensation and the discomfort, the pain with it, that alone is enough that a lot of people want something done. So it's pretty rare that people, don't ultimately end up deciding to have surgery. But if it's not bothering you that much, you could probably make a case to watch it for a little while. It's definitely a good discussion to have with your hand surgeon. Honestly, hand surgeons are who does most of these ulnar nerve surgeries. Even though it's up at the elbow, it's a nerve, and so a lot of the times the hand surgeons deal with it. Definitely a good question to ask them. Okay, have you dealt with this problem? Do you have a nerve behind your elbow, the ulnar nerve, that snaps back and forth, the subluxing ulnar nerve or snapping ulnar nerve? I would love to hear your experience. Below this video, talk about what you had and potentially what you did about it. Did you have surgery? What did the surgery entail? How long did it take you to get back to what you wanted to do? And are you better now, or are you still having symptoms? I'd love to hear your thoughts, and I know other viewers would love to because they may be going through the same problem. And if you know somebody that's dealing with an ulnar nerve issue, please share this video with him or with her so that hopefully it can help that person make the decision that's best for whatever they're trying to do. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. I record a couple of these videos every single week and they'll get delivered directly to you. And last, there's so many resources on ways to stay healthy and perform your best that I share completely for free. So go to my website, drdavidgeier.com. The link's down below this video. Enter your name, enter your email address at the very top of the page, and I'll deliver those a couple of times a week completely for free directly to you. Thank you so much for watching. Really appreciate you watching. If you have other questions about bone and joint injuries, if they affect your sports or exercise, send those my way and I'll try to answer those in an Ask Dr. Geier video. And I look forward to seeing you right here in our next Ask Dr. Geier video.